Part 2 video regarding congestive cardiac failure. Okay, now we will discuss about part 2 regarding congestive cardiac failure. Okay, we have discussed already in previous video what is meant by congestive cardiac failure. Okay, now we will discuss about in this clinical manifestations. Okay, what are the clinical manifestations? Once the children is suffering with the one disease condition, that is the cardiac failure, how we will denote the children compulsory or exactly suffering with this type of disease means depending upon their symptoms. Okay, once the children is affected by this disease, some clinical manifestations or some signs and symptoms we will see on the children. Okay, by clinical manifestations only or by signs and symptoms only we are differentiate the children will be suffering with this type of disease, that is the rheumatic fever or heart failure or hypertension or diabetes mellitus. Okay, whatever it may be. Why? Because different disease condition having different signs and symptoms. Okay, as a student knows or as a viewers, we learn about complete theoretical knowledge on the disease condition. In practical way, we are differentiate the children only suffering with this type of special signs and symptoms is there in the children's. Okay, that purpose only, that's why only we have to discuss this condition in detail about. Okay, first signs and symptoms, that is the tachycardia. Okay, who are affected by this disease of congestive cardiac failure, those children are having increased heart rate. Okay, next another symptom like the children, when we will observe the children, their extremities will be look like very cool. Okay, next another symptom like restlessness. Okay, simply they are having the irritation or they are doing simple work and they are feel more tiredness. Okay, next another one is the tachypnea. Okay, the breathing should be increased in the children's. Why? Because due to the metabolic rate, okay, in that body the children are having increased metabolic rate means they are needing increased oxygen supply to the body tissues. Okay, then the breathing should be increased in the children's. Okay, next another reason like the children or another symptom like the children are having pallor and weak cry. Okay, they are having they are doing one sound, that is the cry, but their crying nature should be very weak. Slowly they are cried. There is no noise for crying and they are not having activeness. They look like very dull. Okay, another symptom like cyanosis. Okay, bluish discoloration of the skin. Why? Because the heart not pumping sufficient blood, sufficient oxygen to the body parts. That's why the children are having the one symptom like cyanosis, bluish discoloration of the skin. When we will observe, when we are assessing the physical examination process step to the children, then the children are having the one bluish discoloration of the skin. Okay, next another symptom like common symptom, that is the respiratory symptom, that is the cough. Okay, they are having this symptom. Another one is the fatigue and they are showing one symptom, that is the hepatomegaly, increased liver size. Another one is the edema formation. Why? Because the kidney not having sufficient function, the kidney not purifying blood, not excretion of what is that, urine. Okay, the tubular reabsorption is there, means in the tubules having the reabsorption. Okay, the fluid should be completely obstructed. That's why the children are having the peripheral edema formation. Okay, next another symptom like decreased urine output. Why? Because the kidney not having sufficient function or appropriate functioning of glomerular filtration rate. Okay, due to decreasing glomerular filtration rate, that's why the children are not excreting urine or not providing urine adequately. Okay, next that's why the fluid should not be excreted out of the body. Okay, the fluid should be completely accumulated in the internal organs of the body. That's why the children are having the excessive weight. Okay, when we will check, when we will assess the weight of the children, the weight should be increased. Okay, next another one is the anorexia. The children are having the one common symptom, that is the digestive symptom, that is the loss of appetite. Okay, another one is the poor feeding. When we will give some feedings to the baby, the children are not taking sufficient feeding. The children are not receiving appropriate feedings. Okay, next another one is the diagnosis. Okay, depending upon these symptoms, we have to do some assessment of the children. Okay, in this diagnosis, we have to collect some baseline data regarding children. Okay, in this what happens means, why we have to do the diagnosis of the children means for providing appropriate and prompt adequate treatment, adequate care to the children. Why? Because the children in our society, the children are having many of the diseases. Okay, when we will doing some assessment, when we will collect exact information regarding children, then only we are giving, then only we are proceeding correct treatment to the children. Okay, this is the way for curation of children. Okay, by communication only, by assessing only, by diagnosis only, we are collecting some information regarding children. Then we will proceed for administration of medications to the children. Okay, in this assessment, first step, that is the history collection. Okay, in this history collection, we have to collect main history regarding children's age group, and the children are having any infections, or what is their heart rate. Okay, by assessing, by auscultation, we have to listening the heart sounds. Heart sounds are having any murmur sounds, that will be assessed. And if the children are having tachypnea, okay, breathing should be increased or decreased, that will be identified by doing the palpation of the children's body. Okay, next another symptom, like the children are having any cyanosis. Okay, if the body internal organs not receiving sufficient oxygen or sufficient nutrients, okay, in externally the children's or the body should showing one symptom, bluish discoloration. Okay, depending upon the symptoms, we have to differentiate, we have to decide, we have to diagnose the children's disease condition. Okay, this is the useful for the for providing accurate care, accurate treatment to the children. Okay, next another one is that we have to do the physical examination. Okay, by inspection, is there any peripheral edema formation, or the children are having any cough symptom, or any weak cry, or the children are having any cool extremities. Okay, these are the symptoms we are assessed by doing physical examination of the children. Okay, next we go for the another step, that is the chest X-ray. By doing chest X-ray, we have to identify any structural or functional abnormalities there in the heart. Why? Because in the heart congestive cardiac failure, one reason, that is the valvular stenosis. No, okay, valvular stenosis or valvular regurgitation. Okay, in this disease condition, we are by doing X-ray, we have to collect exact information regarding heart structure, heart functions. Okay, for identification of client disease condition. Okay, next step, that is the management. In this management, as a nurse, as a medical department, we have to provide bed rest to the children. Okay, next another one is the comfort position. Okay, why? Because the children are having a discomfort, means they are not receiving any treatment from the healthcare providers. Okay, when we are providing comfort position to the children by sitting or by sleeping or whatever may be, which position is comfortable, that position we have to provide to the children, then the child will be cooperating for receiving any treatment by which treatment is providing by the healthcare providers. Okay, next another one is that we have to administer that digoxin therapy. Why? Because this is the best treatment, best medication for improving their heart functioning. Okay, next another one is the diuretic therapy. Why? Because due to the diuretics, excretion of urine, okay, increasing renal function. Okay, this is a useful medication for the diuretic, that is the renal functioning improving. Next, is there any infection, that is the endocarditis or myocarditis or whatever it may be, viral infection or bacterial infection is there in the lungs or the pulmonary or diseases or heart diseases is there. Okay, in the disease condition we have to administer that antibiotic therapy to the children. Okay, for prevention of infection, for control of infection. Okay, next another one is the diet. Okay, in the diet or in this management we have to provide sodium or potassium supplementation to the children. Okay, by providing potassium supplementation, the children are improving their health. And another one is the ACE inhibitors we have to administer to the children. Okay, next another one is the nursing management. Okay, in this nursing management, as a nurse we have to provide medications. Okay, which medication is prescribed by the physician, that medications we have to administer to the children or patients. Okay, before administration of digoxin therapy to the children, okay, we have to assess the pulse rate of the children. Okay, now we are going to administration of digoxin to the children, means before going to administration, 1 minute before we have to assess the what is the pulse rate. Okay, the pulse rate is increased or decreased, that will check and administer the digoxin medication to the children. Okay, next another one is the, if the pulse rate should have what is that, means 90 to 100 in infants. Infants nothing but 1 month to 12 months of age group. Okay, that children's 1 month to 1 year of age group children's we will call infants. No, okay, infants the pulse rate is the 90 to 100 is there, means then we are stop that medication of digoxin. Okay, in older children's 70 beats per minute is there, means immediately we have to stop. Okay, next another care, that is the assess the signs. Okay, bradycardia or tachycardia, bradypnea or tachypnea. Okay, is there any loss of appetite, or is there any cough symptom, or is there any weak cry or fatigue, pallor. Okay, what is the common symptoms of the children's? Okay, signs and symptoms we have to observe, assess, and symptomatic treatment we have to provide. For example, the children are having a loss of appetite, anorexia, means for improving their appetite we have to give some medications. Or the children are having the one symptom, that is the what is that, means cyanosis. Okay, for improving their oxygen supplementation to the body parts, we have to give proper treatment. Or one respiratory symptom, that is the cough. Okay, for control of cough, which medication is needed suitable for that control, means immediately we have to administer. Okay, by giving symptomatic treatment we have to improve the children's health. That's why we have to collect the what is the signs and symptoms, what is the chief complaints of the children's. By assessment we have to collect the history. Another one is the, we have to maintain the intake and output chart. Why? Because in this reason, in this disease condition, the children are having the renal failure, or the functioning of glomerular filtration rate should be decreased. You know, the urine should be retention. Okay, some fluid should be retention. That's why the children are having the edema formation. Okay, what is the how much amount should be excreted, or how much ml of water, or how much ml of fluid the children will be taken by the orally. Okay, by maintenance of intake and output chart we have to differentiate, we have to evaluate. For example, 10 ml or 100 ml of fluid will be taken by the mouth, or 50 ml of urine should be avoiding or excreted by the children. Okay, like that we have to give complete and clear information and relevant information to the physician. That's why we have to maintain the IO chart. Okay, next another one is in the diet. Regarding diet, as a nurse we have to give potassium supplementation to the children. Okay, next another step, that is the low sodium diet we have to provide to the children. And in that potassium richest food, that is for example bananas or some dry fruits or some orange juice we have to provide to the children for improving their health. Okay, next another one is we have to, by giving this food or by maintenance of this diet, the potassium less in the blood or in the body means immediately we have to administer oral potassium supplementation to the children for improving their health. Next another step, that is the low sodium diet we have to give to the children for improving their health, for maintenance of their health. Okay, another one is that is the every day, every hour, every time we have to check and monitor the or measures the weight of the children. Why? Because due to the retention of fluid, the children will have the increasing their weight. Okay, due to that increasing weight gain, the children are having the another complications. For prevention of complications, we have to measure the children's health. Okay, next another one is as a parents, if the children are having this type of congestive cardiac failure means the parents are having a good excessive stress. Okay, for reducing their stress, we have to give some emotional therapy to the parents. Okay, some calm and quiet environment we have to provide the children's. Comfortable environment and hygienic care we have to provide it. Unhygienic area we are not giving, or we are not give or offering to the unhygienic area to the children. Why? Because the children are already having high risk case. Okay, that's why we have to give good and hygienic and comfortable environment to the children. Next another one is in that home care means by prescription of these medications. Okay, in the children's curation is there means okay, in the home level what we have to do. Okay, for example, regarding diet or regarding sleep or regarding providing comfortable position. Why? Because the children are maintaining only one or continuously one position means the children may be prone to get one symptom, that is the pressure sources. Okay, this is another complication. No, by every 2 hours we have to changing their positions means we have to prevent their pressure sources. Okay, in the home level what we have to provide it to the children, regarding that we have to explain to the parents. Okay, for prevention of side effects, what are the side effects is there. Okay, how to control that side effects, how to reduce that side effects, regarding we have to give health education to the parents. Next we are discussed about complications. Okay, what are the complications is there means in that complications especially the children are having the renal failure. Okay, complete functioning of the kidneys should be decreased or failure. Another one is the liver damage. Why? Because one common symptom, that is the hepatomegaly is there now. Due to that reasons the children are having the liver damage. Okay, sometimes the children are having the heart valve problems. What is that? Pulmonary valve, or what is that? Mitral valve or tricuspid valve, bicuspid valve. Okay, like that the valve stenosis or valve regurgitation is there. Some problems will be arise due to this congestive cardiac failure. Okay, last one, major complications, that is the stroke. Okay, inadequate blood supply to the all body parts. Then the oxygen should be decreased. The children may have the one symptom, that is the bluish discoloration or ischemia of the heart muscle. Okay.